Hello everyone, welcome to a very interesting and insightful health podcast series, Defeat Obesity. As you all are aware, obesity is the rising challenge of the new India, and we have so many kids as well as the younger population dealing with obesity. Today we have Dr. Mahesh R.Nadagouda, general physician. Hello doctor, welcome to the podcast Defeat Obesity.
Hi.
Dr. Mahesh, many a times we see the person looks absolutely fit, but do you think they are suffering from obesity or visceral fat?
Yeah. So what we all have a misconception is that obesity is we always look at the physical look of the person, but we do not understand what it is doing to the inside organs of the heart, especially for us. So when we have a lot of obesity, there is an increased load on the heart. So let me tell you by giving you a small example. So you have purchased a small car which has a capacity of 4 people, but eventually you start carrying 8 people in that car every day. So initially the car may be able to take the load, but over time the engine starts working harder, the fuel efficiency increases, the tire becomes worn out, and eventually the engine will fail. So in the same way it is also with our heart. So when we gain a lot of weight, there's millions of fat cells being deposited around our body. So the heart is working overtime to supply the nutrients, the blood and the oxygen to the various parts. So with this, what happens is, firstly the heart is working harder each second, each minute. The heart tissue becomes thick and stiff, so eventually which will lead to it becoming weak and leading to heart failure.
Thank you, doctor. And doctor, let's also talk about the topic visceral fat. How does one find out about visceral fat? Is it the BMI that we need to check for visceral fat, or do we have any test that you recommend for visceral fat?
The one thing is in the majority of the Indians, so they may look normal. The upper body and the lower body may be thin, because that is mainly due to their muscle loss. But if you see, there a lot of people will be obese only in the central obesity. So that is what we call as abdominal fat. So in this type of obesity, there is a lot of fat being deposited around the vital organs of our body, especially the liver, the pancreas, the intestines. So in this type of fat, it is like an active organ. Okay, it keeps on releasing certain low grade inflammatory chemicals which are slowly destroying our blood vessels. Along with that, this fat also leads to insulin resistance. So there you have uncontrolled blood sugar, which is eventually going to damage a lot of vessels and affect the heart. So being a normal BMI and having belly fat is also a very big risk for your heart.
Okay, and how do you link obesity and heart disease?
See, one thing is that obesity itself puts a lot of load on your heart and it makes it weak. But along with that, obesity also contributes to many factors which will eventually cause heart failure. So if you come when there is obesity, there is a lot of fat deposition in your heart. So due to that, the heart is pumping a lot more than it usually should. So during this time, there is high blood pressure where the heart is pumping against narrow vessels. Secondly, there is where obesity leads to diabetes. So eventually it leads to the destruction of the blood vessels. Thirdly, there is increase in the total cholesterol in your body. So what happens is that there is an increase in the LDL cholesterol, which is the bad cholesterol, and there is also a reduction in the good cholesterol, the HDL cholesterol. So this leads to plaque formation in the various vessels of the heart and eventually leading to heart attacks. Okay, and the fourth thing is that it also affects the sleep. So during your sleep, there is increased oxygen demand to the body, and this puts an extra stress on the heart. So this condition, we call it as obstructive sleep apnea.
And do we see obesity a big concern only in urban India or the rural India as well?
Obesity does not choose area that whom it wants to affect. It can be young, it can be old people, it can be urban population, it can be rural population. But as we know, the people in the urban countries are morely prefer on the go food, processed food. They have the eating out culture every weekend. So due to this, you can say that obesity is more in the urban centers. But if you consider India as a whole, there are a lot of obese people who are present in the rural areas also, who do not follow a good protein diet. They mainly eat carbohydrate and rice rich meals. So it is almost equal in urban and rural areas.
Okay. And how important is exercise and having a healthy lifestyle important to curtail obesity?
One thing is that obesity can be reversed. So we have certain this thing, like even if you lose even 5 to 10% of your overall body weight, it goes a long way in reducing the load on the heart. It also reduces the blood sugar. It can reverse your diabetes. It can reduce the blood sugar. It increases the good cholesterol and reduces the bad cholesterol. It improves your osteoarthritis. It can better your knee pain. It also increases your stress exercise capacity, and overall the cardiovascular risks will be reduced by reducing even a small portion of your total weight.
Okay. And how important is everyday exercise?
So what we recommend is at least about 150 minutes of exercise per week. So it does not need to be that you do exercise every day a week. So you can divide it into 3 times a week. So if you cover that 150 minutes by slow cardiovascular exercises, cardiac exercises, and secondly, what we recommend is you go for a strength training. So where you build up your muscle and you reduce the fat. Okay. Third thing is that you go for your regular checkups every 6 months, where we measure your BMI, your waist circumference, your visceral fat. We check whether you have fatty liver or not.
And doctor, can you also tell me, there is a lot of discussions, or I feel you're the right person to tell this, black coffee over green tea. What is that one has to follow?
There's a lot of information floating around the web, with the internet and the newspapers and all. So what it has been seen is that black coffee, when taken in a moderation, has a lot of cardiovascular benefits. So it also reduces your risk of having a heart attack. It reduces the risk of obesity. It improves your overall function and your mood every day. So caffeine in moderation is very good, but overconsumption of caffeine has its own side effects. So always consume black coffee in moderation.
Okay, is jaggery good or sugar good? There's always been a debate.
I feel both of them are sugar. If you are having obesity, then eventually you take jaggery or sugar. It's going to contribute to your diabetes. So nothing is as much as better than the other. So always in moderation, controlling your weight based on your sugar levels, where you monitor your sugars throughout the month. Based on that, you can consume both in moderation.
And off late we are also seeing, kids who are obese.
Yeah.
Very obese. What do you tell them, and how do a parent deal with it?
As we know, nowadays in India and all around the world, the obesity in younger children has been increasing slowly. So this significantly impacts the heart. Previously we used to believe that only a person above 50 years can have a heart attack. But since recent years, as we are seeing, heart attack has become so common in youngsters like 20 years, 30 years, 40 years. So eventually it is not that whether they're young or old. Obesity can as a whole affect anyone who are young and old. So when you become obese, there is going to be a significant load on your heart. So the heart is working overtime to take the load of an individual. So anyone can have an heart attack, anyone can have heart failure, anyone can have a stroke, whether they're young or old.
And doctor, can you also tell me, does obesity lead to PCOS, PCOD and infertility in women?
Yeah, sure. See, the thing is, obesity is the root cause for all these things. So we can think of obesity as the root of the tree, and eventually all the branches are your high blood pressure, your bad cholesterol, your diabetes, your obstructive sleep apnea, and newly we have the PMOS, where it affects the women's. So what they experience is, especially in women, they develop insulin resistance due to this hormonal changes. So you can see that they start having irregular cycles, they develop a lot of acne, and thirdly they have this blackening around the neck. Then they eventually develop skin tags, and their abdominal girth also increases. So with all this, obesity plays a major role. So always it is better that when you have obesity, you should consult a doctor immediately and get your basic workup done.
Doctor, when should one actually be worried and running towards a doctor?
Yes, once you have recognized that you have obesity, so you measure your BMI, you measure your waist circumference, you have underlying conditions like high blood pressure, diabetes, PMOS, and other hormonal imbalances. So the first thing what we do is we check your BMI. So once, if you are, as an Indian, if you are above 25, if your BMI is above 25, you are eligible to take treatment for obesity. And if you are above 27 with other comorbidities like diabetes, blood cholesterol, and all those things, you are eligible to go for medical management. So we have a lot of advancements in the medical therapies these days. As we know that we have these GLP-1 and dual GIP and GLP-1 medications, which will help you control your hunger. It will also help you control your diabetes and eventually help you in your weight loss. So along with this, we have to have a holistic approach when you're on these medications. So we have to improve your lifestyle changes, where you have a calorie restricted diet and you have sleep and stress management. Along with that, you have your nutritionist who will help you with the proper diet, and then we help you with certain type of muscle strengthening exercises. And fourthly, for people who have a BMI more than 32, and selective patients, we offer them surgery. We offer them for a bariatric surgery.
Doctor, can you emphasize more on the belly fat?
Yeah. So we see having obesity is one thing, and having obesity mainly in your abdominal circumference is one thing. So there's, as we know, obesity is not the same. There are two types of ways in which your fat deposits in the body. So one thing we say is subcutaneous fat, which you are able to easily pinch, which is seen in your thighs, your hips, and your arms. And the second thing is your visceral fat. So visceral fat is something which will deposit around your liver, your pancreas, your intestine. So visceral fat is found to be far more dangerous than the overall fat which you have. So what happens is that when you have visceral fat, it also functions like a mini organ, you know.
Okay.
So there is it is releasing certain inflammatory chemicals throughout the period, where it causes a lot of damage to your blood vessels. It promotes plaque formation in the arteries, and which will eventually have a cardiovascular risk like heart attack, heart failure, stroke, and all that. And also along with this, the abdominal fat will play an important role in developing diabetes. So it leads to insulin resistance, and eventually it destroys the blood vessels.
Doctor, you also mentioned about GLP-1.
Yeah.
So who is advisable to take that?
See, firstly I want to tell you is that obesity is not just a lifestyle disorder. Okay, it is also a chronic disease. So it requires effective evidence-based medical management. So coming to the GLP-1 drugs, which we have seen a boom in the people using them. So I think it should be advised by a doctor based on certain criteria. Initial evaluation and assessments need to be done, and along with that, a good nutritionist and a good physiotherapist or a fitness coach will go a long way in helping you take these drugs.
And are these drugs safe?
Yeah, see, any type of weight loss you do, whether with drugs or with lifestyle changes, are going to have some impact on your body. So if you are generally going for a weight loss by exercise and diet, even in that, your nutrition intake is going to reduce. You're going to lose a lot of muscle fat if you don't do the right type of exercise, or if you don't have the right type of fitness coach.
Okay.
So it's the similar with these drugs also. So when you're on GLP-1 drugs, you're supposed to have a good protein diet where it prevents your weight loss, especially your muscle. And secondly is that if you with a good fitness coach and your exercise and your muscle strengthening exercises, you can prevent the muscle loss.
Okay. And when somebody is in their weight loss journey, it may be a male or a female, what is the calorie intake that you usually suggest? What's the right set of calorie? Because again, if you've seen, social media is the new doctor.
Yeah.
Everybody is talking about everything now.
Correct.
For example, this GLP-1 also, maybe a lifestyle blogger will also address it. That is not the thing. Here we are here to just clear out the myths and facts, what is actually right for us coming from a doctor. So the calorie intake, when, for example, if I am on my weight loss journey, what is the calorie intake that I should be looking at?
Okay. So so what are the negative impacts you are hearing in the social media and the newspapers regarding these drugs? Because it has not been, people are not taking this in a correct way. So they should understand the science behind it. That is where we play an important role in explaining to them what are the right things they should do and what are the things they should not do.
Okay.
So people who are on GLP-1 drugs, if they are required to follow a strict certain type of diet based on their weight and their BMI, they're supposed to be on regular exercises 3 to 4 times a week. And thirdly, they should avoid certain type of oily food, fatty food, etc. And there are certain small side effects which come with these drugs.
Okay.
So the main side effect they have found is they usually have nausea and vomiting in the initial period. But when you're consulting an expert who is good at giving these injections, so we guide them through in such a way that the side effects are very minimal. So yeah, that is where you need to consult a good evidence-based and effective doctor.
Okay. And obesity and working.
Yeah.
We see a lot of working professionals with obesity, sleep disorder. I'm sure it is because of their late night calls and meetings, and they don't have a set time for lunch.
Yeah.
So does all this lead to obesity? Then finally heart disease. Does this all lead to heart disease?
So how I can explain this is, see, obesity has a lot of factors behind why a person can be obese. So initially, your genetic or family history can play a very important role, and then your lifestyle plays a very important role in how you gain weight.
Okay.
And the third thing is the underlying diseases which you have. So especially the hormonal issues which you have can eventually lead to obesity. So a lot of people try various lifestyle measures. They try various diets like this intermittent diet, keto diet, and they eventually, when they see that when the underlying condition has not been corrected, so whatever they do, it doesn't lead to weight loss.
Okay.
And eventually people give up. So that is why we ask them to seek medical advice, where we help them control their hunger and we give them the holistic care and treatment which will help them eventually reduce their obesity and reduce their underlying conditions like diabetes, cholesterol, PMOS, and all these things. So even a small percentage of weight loss can go a long way in reducing the risk of having cardiovascular disease.
Dr. Mahesh, also can you please let us know, what are the early warning signs someone with obesity need to watch for heart disease?
Yeah, see, initially what we see is that people with obesity do not experience any symptoms at all. So we always have a misconception that if someone is having chest pain, that is only what they usually come with to the hospital. So it's not like that. So we know that obesity is slowly destroying the heart day by day when you are obese. So what we see is that people usually don't present with any complaints at all. So that is where we request them and we suggest them that if you feel you're overweight, come and get your regular blood checkups done, get your BP and diabetes levels checked. After this, over a certain period of time, many people may present with chest pain which usually lasts for a few minutes. They feel a lot of heaviness in the body, especially in the chest area, and some things which are pain which is radiating from the heart to the shoulder, to the back, and to the arm itself. The second thing what we see is the warning signs are they may present with swelling in their legs and ankles. So that is one sign that the heart is not being able to pump the blood effectively. The other thing what we see is there may be signs of insulin resistance. So you see that they have abdominal fat, their girth is more, and they present with irregular cycles, they present with acne outbreaks, they present with skin tags, etc. They also may have palpitations. They feel that they can hear their heart beating loudly. So these are some of the early signs which they can present with.
Okay. Doctor, going back to the same question, on how people are eating out. Eating out is the culture now. Everybody does not want to cook on weekends.
Yeah.
All 3 meals may be outside. I'm sure all this is contributing to the obesity.
Yeah. See, especially considering urban population, where the culture has been that they have this system of having weekends where they go out and have a get-together, and especially the drinking culture, the smoking culture in the urban cities. These all play a very major role in obesity, which eventually affects the heart. So you can see that a lot of items available are usually processed food, on-the-go foods, 2 minutes foods, and all that, where usually a lot of fried items and processed items. So all this play a big role in fat deposition in the body.
Well, thank you, doctor. It was really nice and very insightful. Thank you so much. Do you have anything else that you feel that I have missed out in addressing and you need to address it to the general public?
See, the thing I would like to tell you is that obesity should not just be seen from an outer aspect. Just by physical appearance of the person, we cannot say that the person is alright. He may have a lot of side effects. We need to go deeper and look at the various systems which it is affecting. Especially the heart is at the most risk of breaking down. So always prevention is always better. As we know that even losing a small amount of weight can go a long way in improving the overall health of the body, and we can eventually prevent heart attacks and other cardiovascular risks.
Thank you so much, Dr. Mahesh, and I hope you all enjoyed a very insightful session on our health series podcast, Defeat Obesity.